I'll introduce our next speaker. Dr. Sandy Rackley is one of the Rochester colleagues in child and adolescent psychiatry. She's going to talk with us this morning about lessons for adult psychiatry from children. Dr. Rackley.
And actually, we had a bit of a change of topic. So for those of you who do pediatric care, I'm going to be talking a bit about managing pediatric depression in the medical setting. How many folks see children or adolescents in their practice? Okay, so we have a substantial number. What I'm going to talk about today, first, I don't have any disclosures, I don't receive any financial support. I will briefly touch on off-label prescribing, which, for those of you who take care of kids know, is more the norm rather than the exception. What we're going to talk about today first is thinking through tough emotions in kids and when those are pathological and when those are a normal reaction to stressors. To think through and be able to explain to patients and families the role of psychotherapy in depressive disorders, and to weigh the pros and cons of adding medication treatment to depression treatment with kids. I work in our integrated behavioral health program supporting pediatricians and family physicians in their management of adolescents with depression. And I think the biggest challenge that we face in that setting really is sorting through diagnosis. Once we've established a diagnosis, generally a path forward is relatively clear. The big challenge, a couple of us were talking about this at breakfast this morning, is that teenagers have big feels. And it's hard in the moment to sort through what's going on here, what is the clinical picture. And part of this is because negative emotions are normal. Sadness is a normal emotional reaction to loss. Anxiety is the normal emotional reaction to threat. Anger is our normal emotional reaction to intrusion. It's a boundary-setting emotion. These emotions are normal. Our emotions have evolved to be useful to us. And so part of our approach to any patient, but particularly to a child or adolescent who doesn't have a well-regulated system for managing emotions, is first to take the stance that feels are not necessarily bad. Where feels become a problem is when they're getting in the way of life, when they're hard to manage, and then we have to think about what's going on there. Moving into diagnosis, one way we think about this, particularly in children and adolescents, is along a spectrum from healthy to ill, where in the middle we've got a developmentally normal expected variant moving into more maladaptive reactions toward actually ill. So the young teenager who has some sadness after the death of a dog, but generally is doing okay, is having fun with friends, that's a healthy reaction. Sadness from the loss. When that sadness